Trade union Nehawu has vowed to intensify the disruptive strike by public healthcare workers until their demands are met. Hospitals have been negatively affected by the strike since Monday, resulting in the disruption of services. Workers are demanding a 10% wage hike, while government has not wavered on its 3% offer. Katleho Sekhotho joins me now in studio, our reporter covering the story on the field. Katleho, good afternoon to you. We have seen the devastating impact of the strike. I mean, we've seen loss of lives and how this has really crippled the entire sector. And now we're hearing it's going to continue.
Yes, that's exactly what we heard today, Mpho. We heard that Nehawu is saying they're going to intensify the strike. And when we asked them, what do you mean by intensify? They said, well, we can't really tell you our strategy. But we did see the disruptions earlier on this week at hospitals especially and at the courts as well, and a number of government offices. So they're basically saying we've reached an impasse in our discussions with government and we're going back to the streets. And take a listen to what Nehawu President Mike Shingange had to say about the loss of life that you rightfully indicated earlier on. We heard from Minister Joe Phaahla earlier on in the week saying the preliminary report indicates that 4 people died due to or as a result of the strike. And Mike had this to say.
But the comments of the minister and the disparate attempt to link the loss of lives to the strike of the union, we know they're going to do that thing because they are a state. That's what states do in their quest to defeat workers and crush the strike. Not only they will intimidate workers on dismissals, no work, no pay, they will use courts, they will use police and soldiers, but also they will use propaganda machinery to turn the public against the striking workers.
Yes, so Mpho, we're hearing from Mike there saying that government will use any form of intimidation to try and stop workers from carrying on with the strike. And they're saying, look, we are not afraid of any intimidation. They will deal with the, obviously the issue around hospitals and the issue around the chaos that we saw, saying that they will try and make sure members don't take it too far. But we did see police on site at many of the protests that happened over the past week. Police also not using excessive force. We also heard from Max Marshall, from the police, from the Joburg district, explaining that they didn't want to use excessive force on the members because they don't want to escalate issues. So it's a lot of things at play. We have what's happening in court, what's happening in the streets, and as well as the bargaining, the bargaining that's happening between government as well as the unions, seeming not taking place at the moment. They have reached that impasse. But it will be interesting to see when they will actually go back to the bargaining table.
Yeah. What is also going to perhaps add to the intensity of the strike action is what we heard this afternoon, the Health and Allied Workers Indaba Trade Union saying they'll also be joining.
Yeah, so we've heard from that union as well as SAPU, as well as Pop Crew and NUPSA saying they will be joining Nehawu in the strike. They will be working together, increasing the numbers of people who are not going to work, who are demonstrating in front of state-owned facilities and really bringing public service delivery to a halt.
Yeah. And especially as we listen to Haitu saying that they are recommending or advising that everything comes to a standstill.
Yeah.
They were talking about how people in the wards should be outside joining them. And that in itself really paints a very frightening picture of what's likely to happen as the week gets underway. What is the impact on the ground? How many people will be affected? What does it mean for day-to-day care in hospitals and clinics?
Yeah, I mean, if any indication, what we saw earlier on in the week, the briefing with the health minister, he was sitting alongside him was the CEO of Charlotte Maxeke, that was Gladys Bohoshi, outlining the day-to-day effects that the strike is having on the hospital. So, for example, you have certain units not being able to function. She was explaining how you have 33 theatres in the hospital, but only 2 were functioning. We heard from her that 61 selective C-sections had to be cancelled because of the strike. So it was these kinds of effects, or these kinds of very real effects, that the strike is having on patients, especially at hospitals, but definitely as well at other department offices, as well as in the courts.
Yeah. Some developments there, Katleho Sekhotho, giving us an update of what's to come in the week, and of course the latest around trade union Nehawu vowing to intensify its strike action.